All right, perfect. Thanks a lot. It's good to see everyone here today, and we'd like to welcome the ones that were joining us from online. We'd also like to acknowledge the Pink Shirt Day and the anti-bullying. So it's great to see that so many people have chosen to wear pink shirts just like us, so we all look alike and we're all twinsies. Let me start by saying our student mental health presentation, where it came from. So back in the fall semester, we were approached by a number of staff members mainly, who were really concerned with some of the behaviors that they were seeing in their classes and in their labs. The anxiety levels that they were describing in some cases were very extreme, and they were feeling very uncomfortable with knowing how to approach and what to do to assist the students. Besides that, we had quite a few of our senior administrators mention to us that faculty and staff were mentioning it to them, that they were seeing anxiety in their classes and in their labs, and they were not feeling comfortable in making the approach and knowing exactly what to do. Added to that, we saw that our numbers, we were concerned because of COVID for the last couple of years, and in the fall, we had expected that our numbers, or the students who would come to us experiencing extreme anxiety or any type of anxiety, any type of a mental health challenge, would probably be a little bit higher than what we had seen in the past. Besides that, we saw an emergent need in our CPS, our Counseling and Psychological Services unit, whereby students wanted something immediately. And that particular services really wasn't built to be able to withstand that type of a need. So, hence, what we did is we got together and we came up with this student mental health presentation that we're going to give to you today. I'll start by giving you a little bit of an overview. Malfunction, clicker don't work. Should I move? There we go. Okay. So we'll start with a little bit of an overview in terms of what it is that we'll cover today. But let me start by just saying that the whole focus of this particular presentation is just to increase your awareness of the campus resources that are available to assist you as you work with students. Increase your awareness of the resources that are available in the community that are fairly easily accessible to you, that you can use yourself if you were in need, but you could certainly refer your students to them. But to also reassure you that, you have a skill set that you've developed, and listening is a part of that skill set, and that's usually your basis or your first step in working with any student. So let's hope that the information that we can give you today will give you a little bit more confidence in your approach to working with students who display mental health challenges. We'll start the presentation by telling you a little bit about our team. We call it the CMT. It's the Case Management Team for Grenfell Campus. We'll talk a little bit about what the current climate is, what we've seen at Grenfell Campus over the course of the last couple of years, but definitely last semester when this came to light and our faculty and our staff start identifying this as an issue. We'll talk to you a little bit about some of those on-campus resources that you can use, some of the online, in-person, and telephone resources that will be available to you and are currently available to you. But then we're going to get into what your role is as a Grenfell employee in terms of working with students who are displaying mental health challenges. We are going to give you a coping exercise called belly breathing. It's something that you can use yourself, or something that you can tell your students about. And we thought we'd follow up with a couple of scenarios. And the scenarios are really instances that we've experienced or have been brought to us that faculty and staff have experienced over the course of the last 3 or 4 months with students in classroom. We'll follow it up with a question and answer session. So we're going to try to keep to our timing as much as we possibly can. We will ask that you leave your questions until the end. So if you can jot them down on a paper in front of you, that would be great. If you're online, please feel free to put them into the chat, and Melanie is here with us, so she'll be monitoring the chat, and we'll get to those at the end. All right, let's try this again. All right, so let's start with introducing the case management team. I'll start with myself. Many of you know me, but my name is Lorna Payne. I'm the coordinator at the Learning Center at Grenfell Campus. In terms of my work on the team, I'm very much the person who would provide the assistance when it comes to academic support programming. So if the student is having an issue when it comes to their academics, I'll usually do the work in terms of helping the student when it comes to that.
Thanks, Lorna. And I'm Jennifer Broadbent. This is my first year chairing this committee. Usually a representative from CPS, Counseling and Psychological Services, will chair the case management team. So it's been great working with these folks. I'm one of 2 counselors here on campus, and I provide, I guess, the mental health expertise on this team.
Hi, my name is Connie Fudge, and I'm the manager of campus enforcement and patrol. We work closely together with all parties on this team, as well as many different departments on campus. And we provide support to students that may be in crisis, or student that may be just having an anxiety attack. So we do provide those supports.
Hi everyone, my name is Sabrina Short. I'm the acting manager of student housing. About half of our population here at Grenfell live on campus with student housing. It's oftentimes student housing staff or campus enforcement officers who will first recognize concerning behavior, as concerning behavior may happen in the evenings, overnights, and on the weekend.
So the CMT started in 2014, and in 2014 we had a mandate that we've maintained since that point, and we were set out to provide support and care to students who were exhibiting behaviors that might negatively impact their own well-being or the well-being of others. There are 3 ways that students can make it to the CMT team. One is they can self-refer to us. Another is a faculty or a staff person, with the student's permission, can make a referral to one of the members of the CMT team, and we will take that student's case on. Or if we start seeing a large number of cases, or a number, not necessarily a large number of cases, through our CEP office, then the student could be referred to the CMT process, and we would start working to identify a plan of action for that particular student. So what we do is we assess the student's case. We look at what the whole situation is. We try to develop and implement and make a plan for that particular student so that the challenges that person is experiencing at that point in time are all addressed. We monitor and we evaluate to ensure that the student, what we've put in place for the student is working for the student, and we make modifications if we need to, and we evaluate at the end. So at the end, we're taking a look at, did this really work? Because we like to learn from, the different cases that we've had in the CMT process. Throughout the whole process, we make ourselves available to the student, and we try to provide guidance and advice.
Oh, that's me. So what we're seeing at Grenfell campus, as mentioned, I'm one of 2 mental health professionals here at Grenfell. We book approximately 200 appointments per semester. We see a variety of mental health challenges, including most of these and a few others. In the past couple of years, understandably, we've been seeing a lot more anxiety, stress, mood-related issues like depression, and stemming mainly from isolation, but other issues as well. Basically, we work to give students the tools they need to be able to cope with their issues. The majority of our students self-refer. We prefer it that way because, and we'll talk about later, you can't really force anyone into counseling. So we have our students call our office and they book an appointment with us. As mentioned before, CPS is not really an emergency service, so it's more of a appointment-based service. And I think, did I leave anything out there, guys? No? Okay.
Okay, Lorna.
So added to what CPS is saying, I'll tell you a little bit about ACES. So ACES is the Accessibility Center and Educational Support Unit for Grenfell campus students. So students at Grenfell who have a disability or a medical condition and will need accommodations have to register at ACES. So just to give you an idea of what we've seen, in 2015, ACES was activated at Grenfell campus. We had 89 students who were registered with us. 6 years later, in the fall of 2021, we have 219 students who are registered with us. Of the 219 students who are registered with us, they have self-declared to say that mental health condition is the reason that they're registering with us, and they're looking for accommodations within their classrooms or within their courses. So the numbers in terms of mental health challenges are also being seen in that particular unit at Grenfell campus.
So in student housing, we're seeing more and more students struggling with their mental health concerns. So each fall, we are receiving a number of increased applications for alternative accommodations. So accommodations with private washrooms or private kitchen facilities. So our student staff members, so our resident assistants and our chalet advisors, are also reporting having more and more conversations with students who are struggling with mental health concerns and who are reaching out for help. That's what we want to see. We want to see that students are reaching out for help because we want to be able to help and support them the best way that we can.
For Campus Enforcement and Patrol, we track all of our stats for all of our calls related to anything that occurs on campus throughout the year. And it's called the MIMS reporting system. And under that tracking, we also track physical health, illness, and mental health illness. And if you notice, I've got some of the stats written on the board, but I will mention them. In 2021, we're not fully in person. We're almost fully in person. We had 64% of our calls for health related were related to physical health, and 36% were for mental health. In 2020, roughly about the same, 63% we were fully online, and 37% for mental health related calls. In 2019, when we were in full person in class teaching and learning, we were at 59% for mental health related calls and 41% for physical health calls.
This is me? Yeah, hard not being able to see it. Okay, so we have a lot of resources right here at our disposal at Grenfell campus, and we're going to talk about a few of them. So first up, counseling and psychological services. Currently at CPS, we're seeing students virtually. We've been doing that since March 2020, but hopefully I feel like maybe that will change in the coming months. But right now, we are seeing students through WebEx. On our website, which is listed here and should be in your kits as well, we have a step-by-step process for how students can book with us. Also, if while they're waiting for an appointment, because I do often hear, well, if I book with a counselor, I'm going to be waiting for a couple weeks, which isn't always the case, especially if you're a nursing student, because the nursing, I'm solely with nursing students for 2 days a week. But there's a list of alternative resources that students can avail of while they're waiting for counseling. We also have a wellness library here in our office, as well as online through the Grenfell Library. So students can, I know this should probably go with online resources, but because we have it in person too, we also have it online, and students can just search for myself or Dr. Veronica Hutchings as their instructor and access all of our wellness library as well.
Under Campus Enforcement and Patrol, like I said, we work closely with all departments, especially CPS and student housing. Most of our officers are trained, or I should say all of our officers are trained in mental health first aid, as well as applied suicide intervention skills training. Some of our officers also have mental health training with emergency room nurses and paramedics. So they're all able to offer supports to the students. Normally, if we have a student, sometimes we'll either see them in the room, or a lot of times students are brought to our office. We do have a smaller inner office inside our control room area where we'll bring a student, so that way they can sit and relax. We do have a phone there if they wanted to call some family support or a friend for support. We provide them taxi service to hospital if it's more of an urgent matter. We also would call an ambulance for a student if that was required, or we'd also call the mobile crisis response team, which is a partnership with Western Health and the Royal Newfoundland Constabulary.
So as mentioned before, our team accepts referrals in a variety of ways. So students can self-refer. As a staff and faculty member, you can also refer a student, but please have the student's consent to discuss their case prior to bringing it forward. So to refer a student, you would get that consent, and then you could approach any member of our team. It's important to note that our team doesn't operate in a silo. So depending on the student's need, we may involve other departments here on campus or outside agencies within the community. So in the past, we've teamed up with the Salvation Army for food and clothing vouchers, the Corner Brook Women's Center, as well as the Healthy Baby Club. So really, we're here to support the student in whatever way we can.
Sabrina. I'm not sure if Tracy is here online, but Tracy Kreisberg is our somewhat new sexual harassment associate here at Grenfell. She's located here in the Arts and Science building, and she's available 3 days a week. I have the exact office hours printed in your kits, but she is also a great resource, and students can self-refer. They can contact her by email or phone. Next. Okay, some in-person resources. Oh, I think Connie, you're up there.
One of the things that Campus Enforcement Patrol does here on campus, we'll do wellness checks. So we might get a call, receive a call from a parent. It could be a friend of a student, or it could be a faculty or staff member that might have concerns about an individual. They mightn't have seen an individual for several days, or mightn't be able to contact them by phone or email, for example. We would do a wellness check if the individual lives on campus, just to check in and make sure they're okay. So we'd send an officer to their room, normally in partnership with someone from student housing. If the individual is not located in the room, we will leave a note and ask them to get in touch with us. We won't be able to provide any information to the caller, but we will ask the individual to get in contact with the caller. If it's a person or a student that lives off campus, we would have to work closely with the Royal Newfoundland Constabulary, as they would have to do a wellness check within the community.
Thanks. We also have been working with Western Health Youth Outreach worker Dave Jones. We've been so lucky to have him as a resource. We've been working with him for several years. I had a big spiel of what I was going to say, but I think we have Dave with us virtually. Dave, did you want to introduce yourself and just say a few words about what you do? And I don't know where to look.
I'm here.
What you do. You're here?
Yes, I'm here.
See you?
I can see me, but you mightn't see me. There's lots of people, but that's okay. You can hear me.
We can hear you.
Yeah, so my name is David Jones. I'm the youth outreach worker. It's actually youth early intervention and outreach worker. I work with youth between the ages of 12 and 29, so it's a very unique position. I am not a counselor. I offer supportive counseling. So I have been working since my email has been put in the newsletter. I have had the opportunity to work with some international students, and it's kind of like letting them vent, giving them coping skills, maybe giving them, options and resources in the community to navigate, talking about healthy relationships. So I've had some relationship and interpersonal conflict issues come up in my meetings with students when we're talking about issues, I guess. But I can also accompany people to appointments if they're nervous about going to see somebody. I think I saw Ken Jacobs on here. I even worked with a student one year to help drop courses, just to kind of help them navigate that system. People are intimidated sometimes by systems, and all it takes is, and if they're here by themselves without any family support, it's nice to have an adult that's willing to come in and be like, okay, I'll help you, I'll support you. I mightn't have to do it all, but I can help guide them and make them feel more comfortable about it. I also use like different techniques. So I'm prevention and promotion. So I offer presentations. I can do workshops. I sometimes my background is education and fine arts. So oftentimes I will mix mindfulness and carving, and I'll carve with individuals I'm working with to kind of give them options, outlets. So
That's awesome.
basically, I'm a jack of all trades. I can do a bit of everything. I'm not tied to a location. I use Zoom Health is what Western Health uses, so I can offer virtual appointments if people aren't comfortable. I can meet students where they are. I can go meet them at a restaurant for a coffee, and we can talk over coffee. So I'm completely mobile.
That's awesome. I don't want to interrupt you. Is that
Yeah.
you're
Oh
good?
no, and if you want, the referral process is simple. There is no real referral process.
Yeah.
If a professor wants my email address or contact information and they're concerned, they can contact CPS. You guys have everything. They can contact me directly, or they can give the student the information and let them know. Because we understand that some people, and I have worked with some students this year that are hesitant about the official kind of counseling. There's still a stigma around mental health. But when you're like, oh, I'm just a support. I work with mental health and addictions, but I'm not a counselor. Just going to give you some tips. And sometimes I can urge to help support them in actually feeling good about going to get counseling. Kind of talking about those subject areas.
You talk me up, right, Dave?
I talk you up all the time. I talk
That's
Connie
awesome.
up. I talk everybody up. Everybody's wonderful.
And also what I'm hearing is if you want to drop Ken Jacobson's courses, we can contact you.
You don't be saying that because Ken will get mad at me.
No, we love Ken Jacobson. I know you're out there, Ken. You're awesome, and I was just kidding. But Dave is just an incredible resource. Like he mentioned, some students are a little hesitant. The whole clinical. I mean, you can see how formal I am, and some students are a little nervous about that. But in all seriousness, the clinical environment is scary, and Dave can meet you for coffee. Like he's just so down to earth, and he mentioned that since we put his name in the newsletter, just before Christmas, I mentioned that we have a step-by-step process on our website and some alternatives to while you're waiting for counseling or instead of counseling. And Dave's name is there. And since then, he's been getting some students reach out to him, which is amazing. So thank you so much, Dave, for being here. And I think his information's in the kits as well. So
No problem.
Yeah.
Now,
Awesome.
I do have to take off a bit early, but if anybody got questions, they can just email me.
Okay.
Is that cool?
Awesome. That's cool.
Okay.
Thanks, Dave.
No problem.
So I guess moving on to in-person resources in the Corner Brook area, you're probably familiar with Doorways. You've probably seen some posters around campus. Western Health, it's a walk-in free single session counseling. So it's run by registered social workers and students or yourselves. You can just walk in, you don't have to book an appointment. I understand, and I think it's 5 days a week. We do have it in your kits as well, so you'll have the exact hours. And I do feel that since COVID happened, they are taking phone sessions as well, so you can call. I have had some people tell me that they've said, I only get a lunch break and I'm working out of Stephenville, and they've called and just done a phone session from there during their, so it's sort of, you can make an appointment, but it's also, you can just walk in whenever, which is a great resource.
Next is the mobile crisis response team, and as I alluded to earlier, it's made up of mental health care workers, so it'll be a mental health social worker or registered nurse, and a plainclothes RNC officer, so Royal Newfoundland Constabulary officer. They have a team that'll actually come to where you're to. It could be a student might call them up themselves because they might not feel well. It might be a crisis situation. They're easily contacted through the RNC's line, which is 637-4100, or you can call 911. This team works 7 days a week, and they're available from 10 a.m. to 10 p.m. daily. Because of the contact with Western Health, you can sometimes get in to see a psychiatrist or an appointment that you're trying to get at Western Health sooner by going through the mobile mental health crisis or the mobile mental health crisis unit or crisis response team.
We also have mental health liaison. We don't have a mental health liaison nurse. Western Health has a mental health liaison nurse available every day, 7 days a week from 4 p.m. until midnight. So if it's a crisis situation, or if you or a student doesn't want to wait for an appointment, you simply go to Emerge or Outpatients, and when you register, you just let them know. I feel like I'm telling the nursing faculty here how to see, so I'm going to look at someone else, how to see a mental health liaison nurse. So you just tell the people on registration that you're there to see a mental health liaison nurse, and they're in contact with the psychiatrist on call, and they've been wonderful to work with according to the people that I speak with, and they're available every day. So that's great. We did include private practice mental health professionals. We realize there are quite a few in Corner Brook and surrounding area. There is a fee associated with that. However, members of Halibu I think you can get up to 25 sessions for free through NIHB or non-insured health benefits. So that's really great. Or if you have insurance, there are private practice mental health professionals as well. So we have some telephone resources. Is that up?
Yeah.
Okay. The first one is a new one that I think is just absolutely fantastic. It's for international students. It's new to Memorial, but you can get information off the CPS website. There's a link there for international students. And basically, international students can access a counselor 24/7 in over 60 languages. So they can be paired with a counselor who's very familiar with the culture, who speaks their language. So I just think it's a really great resource for our students here as well. And there's more information on keepmesafe.org as well. I have used, and I'm sure you folks have probably used or given students the mental health crisis line at some point. This is, again, 24/7. You get to talk to someone right away. Even some of my students who were very hesitant to call any helpline had excellent success talking to the people on the mental health crisis line. First Nations and Inuit Hope for Wellness Helpline is available, and for the 2S LGBTQIA+ community, there's a few lines there as well, the youth line as well as the trans lifeline.
The United Way's 211 service is staffed by a local team member, so someone who's within the province who can then connect individuals to the appropriate community-based supports. So 211 can help individuals who are experiencing food insecurity, homelessness, who need help accessing Indigenous resources, and a whole lot more. So for someone who's reaching out to a helpline for the very, very first time, it can be a rather intimidating experience. However, if someone does call 211, they just dial 211. They speak to that navigator who's in place, and then the navigator makes sure that their call is transferred to the appropriate helpline.
I love that one because it's easy to remember, right? If you're not sure who to call, like, do I call the mental health crisis line? I don't really know. You just call 211 and they can ask questions, assess the situation, and then.
Super easy.
Yeah. So online resources. I won't bore you. You can read these resources. I won't just read down through them. I would like to give a shout out to the Grenfell Mindfulness Program because that was developed by Dr. Michael Newton, who is a retired professor here, and Dr. Veronica Hutchins as well. So she's on sabbatical, but she normally works at CPS. And it's a great program for anyone, not just students. And also, I added a little picture here. So if you look at the fourth one down, I think, is WellTrack. So Memorial has a license for WellTrack, and which means we are given an access code. So if you or a student would like to use the WellTrack interactive program, the code is Memorial. I'm not sure if the WellTrack cards are in your kits. Are they, Sabrina? Okay. If they are not, you can always contact me. If you have any questions, you can contact any of us after this presentation. But WellTrack is an excellent one, especially for students who are having anxiety about presenting And I see a lot of students who have pretty severe presentation anxiety. And this is actually, if you click, we can't click play right now because it's a screen capture, but if you click play, it actually moves around an auditorium like this one, and you see the students like moving and drinking and coughing. And so it really feels like you're at a podium, and it gives students the ability to sort of practice doing their presentation in front of this auditorium. It's almost a little intimidating when you first look at it because it's very real. But anyways, it's just a great resource. So I just wanted to point out those two. Okay, so this is why you're here. So your role as a Grenfell employee. So, obviously students have physical health, mental health is part of health, and you are working with them on the daily. So I'm sure sometimes you might ask yourself, where does my role as a faculty or staff member, where is that boundary between helping them with their health and sticking to sort of my role as a Grenfell employee? So I'm just going to run down a few things. We are going to go through some scenarios. So for medical emergencies, so obviously we know if someone's bleeding, if someone has a seizure or a heart attack, we're going to call 911, right? Like we're using AED device if you know how, but we're going to call 911. And if we're on campus, it's nice to also contact CEP as well so that they can be on the scene as well. I'm sure Connie could speak more to that. If you see a student crying outside your classroom, so crying is a very natural, emotional release. In fact, I think it's really positive when I see someone cry. Now, I know I'm in the mental health profession, but when I see someone cry, I'm like, oh, awesome. They're crying, they're letting it out. So if you see someone crying outside your classroom, if you're comfortable and you have a rapport with that student, sure, you can, are you okay or something like that, but it is not quite in the role of your job as an educator or as a staff member at Grenfell. So they may just be trying to get away and wanting to have a little cry and just not be noticed. And so it's okay. You don't have to feel like you need to take care of that student. Similarly, if you see them crying in your classroom or in your office area, if you're working, say, in the bookstore and you see a student crying in the corner, you don't have to approach them. In fact, I would probably say don't approach them. If they're having a cry, it could be about anything, and they're just trying to get away and maybe have a moment and try not to draw attention to themselves. So you can just let them have that. If a student approaches you and asks for help, so they show up and say, this is happening, I need help. Okay, so then it becomes a little bit of your problem. But if you're not a mental health professional, then you have the resources available to give them. So, okay, you can ask them, and listening is often the best thing you can do. I think we have that written there, yeah. You can't force anyone to get help, but you can listen, and sometimes they just need to vent. So if you say, what do you need? And they're like, I don't know, everything's so stressful. Sometimes after there's just that release, they might feel fine. So that's not a mental health crisis, that's just them needing to vent. And you can also say, well, we have all these resources available at Grenfell if you need them, or, there's also these extra, whatever it is, you can give them the resources, but maintaining your, role as your employee or as your staff member. Does that make sense? Does that make sense? And we'll have a Q&A after as well, because I'm sure people have questions about that.
So many of us underestimate the power that our breath can have when we're dealing with stressful circumstances. I'm sure many of us can remember, speaking with a student who's filled with anxiety and filled with stress. So if you're speaking with a student who's receptive to working on a breathing exercise, deep belly breathing is a quick exercise that can be used to help regulate stress and regulate our emotions. Some of you may know that when you're speaking with a student who's already having a lot of difficulty, they can't actually take a full deep breath. So in cases like that, I would definitely recommend sighing as a way to get out everything. So just take a huge sigh, just let it all go, kind of like that. So some steps to belly breathing, and then I thought after we could all take, a couple of breaths together as a group. So we can sit in a comfortable position. Some students may prefer to stand, some may prefer to sit kind of like this, whatever is comfortable for that person. People can close their eyes or maybe just cast their gaze downward. And then we're going to breathe in slowly through the nose while counting to 5. Some people like to put one hand on their heart and one hand on their belly to feel the rise and fall of their breath, and then breathing out through the mouth. And then we can do it for a couple more breaths. So if you're so inclined and you'd like to take a couple of deep belly breaths with us, please feel free to do so. So sitting in a nice, comfortable position, whatever is comfortable for you, with your gaze cast downward, perhaps your eyes are closed, breathing in through the nose, 1, 2, 3, 4, 5, and exhale through the mouth, 1, 2, 3, 4, 5. And for our next breath, use your own natural rhythm. Awesome. Great job. So some of the benefits of belly breathing include slowing our heart rate, helping us get to a place of relaxation, which we could probably all use, getting more air into our lungs, helping boost our energy, and an increased awareness of our breath and the power that our breath can have. So if you're inclined towards breathing exercises, YouTube does offer a lot of different guided breathing exercises that you can take advantage of. And so we finally have reached the scenarios. So we do, excuse me, we do have a couple of different scenarios that we thought we could work through as a group. Please feel free to contribute what you would do or how you would handle a situation. So these scenarios are more so geared towards the teaching environment. However, we know that many of our staff members face similar situations with their interactions with students. So scenario 1, you're teaching and you notice a student is crying in their seat. They get up and leave the room. What do you do?
Take a seat. Okay. Watch. So if you're teaching, yeah, or if you were giving so you have a group of students and you notice the students crying, they get up and leave. So do you stop teaching? Do you? Okay. Yeah.
Would have, it's my nature though, right? I would have to go check on the person.
So, okay, so say you follow the student out and the student says, I don't want to talk to you.
I would just say, I'm just checking on you, just want to see
Yeah.
how you are. And if they didn't want it, I would walk away.
Okay. And so what if this,
And then
and
go back.
I'm drilling you now just because I'm
Oh, I know, I
curious,
feel
right?
like
There's a
I'm
lot
getting
of-
tested.
I know. Well, just because everybody's different, right? Like you
Yeah.
said, that's my nature. I'm going to go out and check on them. So what if the students start saying things that sounds like they're having like a psychotic episode, or they say, I can't take this anymore, I'm going to.
I'd call Connie. She's my go-to person for, I guess,
Yeah.
situations that I've seen
So
over
you're,
the years since I've worked here,
yeah.
that Connie is my person that I ask.
Okay. So you say, hold on right here. I'm going to go call Connie and hope that
Well,
they stay.
I might not even say that. I would somehow, because of the different areas around, you can
Yeah.
easily access someone or make a phone call to say,
Okay.
can you watch this while I do this, or vice versa.
Okay. Would anyone else do something similar? Oh. Okay, what would you do?
Use this?
Yeah.
I wouldn't leave a classroom if I was up teaching a full, I'm a nursing educator, so
Yeah.
our classrooms are up to 60 people.
Yeah.
I wouldn't leave a class. a lot of times we get to know our students really well because we watch them through a full 4-year program and have a lot of interaction with them.
Yeah.
Depending on the student and my level of rapport with them and my level of understanding of their dynamics socially between other nursing students,
Yeah.
I may actually look at a close friend and say, do you mind going and
Right.
checking on so-and-so? Please come back and get me if the situation is uncomfortable for you.
Yeah.
And otherwise, if I saw the student when I was leaving class, I would approach them because I've worked in mental health as well.
Yeah.
And otherwise, if they weren't around, I'd just send a follow-up email and just say, I did notice that you seemed to leave class. You were upset. I'm just checking to see if there's anything I can do to help you.
Okay.
That would be my approach.
Yeah. So you can see that there are two very different ways of approaching it. Do you want to know how I would approach it? So, and I'm not saying my way is right, but your role as an employee at Grenfell is not to follow the person. You know, okay, I'll give you an example. Like maybe they're crying about their partner broke up with them. They're so embarrassed. They're very embarrassed to be crying in class. So they want to sneak out without anyone noticing. Now, all of a sudden, we got someone following them out, holding class. Now, I'm not saying you're wrong, Jana. This is, you know, you are a very caring individual. But now, all of a sudden, everyone in class knows, because then you get, what happened? Who left? Oh, why do you think they left? What's going on? You know, so all of a sudden, the person who was trying really hard not to draw attention to themselves, everyone knows what's going on. And in that situation, Jana's role was to teach them something, or, you know, you were probably organizing, you know, an event or something like that. But now all of a sudden, now maybe that if you really get to know your students too. So that's a very individual situation because you probably have a relationship with that person and they would expect you, you know, you'd probably know that person wouldn't want me to follow them. But really your role as an employee is to just let them go. Crying is a very, again, really positive, natural response. I'm more nervous when students hold it all in. But if something's going on and they cry, they're having a release. They might not want to do it in front of a group of people. So they, you know, kind of sneak out. And we can just let them go and that's okay. It wouldn't be on you if they then did something, right? Like that's not your role. Your role as an educator, or your role as a facilitator, or whatever it is that your job is at Grenfell.
At the nursing school, I'm also a registered nurse.
Yep.
Worked in mental health, so it's like where's my role between being a nurse?
And I'm glad you said that.
Yeah.
Because this is where, and I said, you know what, I'm going to be the most nervous when those nursing faculty show up today, because you are registered nurses, you are helpers, you have a responsibility as a nurse. However, in that situation, your role is an educator. So your role is not as a nurse. So I guess you're blurring the boundaries then when you become their caretaker or their nurse as opposed to their educator. If they ask for your help, mental health wise, like if they show up at your office, now I won't go there because I think that's a scenario. But if they get up and leave class, that's not a medical emergency, nor is it a mental health emergency. They're crying. That's just like if someone got up and had a headache. No, but you're also not, are you equipped if they walk out and they're having a psychotic episode? Like, do you know what if they say, no, I'm not listening to you, and then they run off campus? Yeah. And I guess sorry, I think I just made an echo. I think in this situation, we're not looking at it as an emergency. It's more someone just started to cry and left. So they're not looking for your help. They're not looking to draw attention to themselves. And again, I'm not saying what I say is 100% right. I'm just saying that your role, obviously you're going to use your own individual judgment, who you are as a person. And I know that sometimes this comes across as cold. I'm just going to let them cry and leave? Like, I feel personally, I'm a very sensitive person. I have kids, I'm a mom. Like if someone cries, sometimes I do get that like, ugh, but then I have to look at, okay, what's my role here? And do I want to draw attention to that student if they're trying to sneak out? Does anyone online have any questions or comments? Okay. Clear as mud. Let's move on to the next one. That was the easy one.
So our next scenario is a student shows up at your office crying and telling you that they're not in a good place right now and can't seem to get to class or to complete their assignments. What would you do? How would you handle that conversation?
I know that teaching faculty get this all the time. There you go, Peggy. She's like, hand me the mic.
I think to a certain degree, I'm a nursing faculty, so I would probably informally use my nursing process. So of course, assess the situation first. Just kind of get a little bit of a background, not that I'm treating them in that way, but are you feeling suicidal ideation? That would be a question that I would ask. And of course, I would help them with resources. Because once again, I'm not counseling them, but I know people who can, so I would give them the linkage to access these services to help them.
Absolutely. Oh, yeah. That's another great resource, right? The Learning Center. So if they're saying, I can't handle this right now, I'm not in a good place, I can't get to class, are you aware of the Learning Center? They have help with writing. I know at the nursing school, you also have writing help separate from. It's part of the Learning Center too.
The Learning Center too, yeah.
Yeah.
So anything related to the academics, a student can definitely be referred to the Learning Center, and we'll assist in terms of whether it's writing or study skills. So if it's because they can't manage their time so they can get things done, we do time management sessions with students, and not just one-time sessions either. We have like mini courses that we've designed that we work with students and provide to students.
Is there anyone who would not? So Peggy, that was great. Like you did, because you're trained to do that assessment. You're comfortable saying, are you having suicidal thoughts? Is there anyone here who would not be comfortable asking that question? Because that's a real hard one. Is there anyone who wouldn't be comfortable saying that? Okay. Well, maybe you'd all be comfortable saying, if a student came in, you'd be comfortable saying, like, are you having thoughts of killing yourself? Sometimes students want that. That's, they're like, thank you for asking me. But if you're not comfortable asking that, you don't have to ask that. You can provide resources. We have the Learning Center. We have counseling services available right here on campus. Oh, but then I have to wait for an appointment. Okay, well, we also have doorways. We have a youth outreach worker who can see you probably tomorrow or this evening. Here are all of our resources. So if you're comfortable asking that question and you have the training or the background, then absolutely. Yep.
Crystal online is wondering, is there a different way to phrase a question about one's mental health?
A different way to phrase the question.
The question that Peggy would ask. Could you phrase it differently?
Are you having suicidal thoughts, like that question?
Yeah.
This is the thing. You don't want to beat around the bush, because if you say something like, are you having negative thoughts? Or are you, like, really? Are you having thoughts of hurting yourself? You don't have to use the word suicidal. You can say, are you having thoughts of hurting yourself or harming yourself? Are you having thoughts about killing yourself? I know it doesn't sound nice, but you know what? It's not. If you're having a heart attack and no one asks you, are you having chest pain? That could be an issue. So sometimes if you have the background, if you have mental health first aid, or if you're a registered nurse or a mental health professional, sometimes you're the first person to ask them and they feel real comforted in hearing that. And suicidal thoughts are very normal. Not everyone who has suicidal thoughts actually follows through, right? I would say there are a lot of people here in this room who have had thoughts like that before. Thoughts are thoughts. It's when the behaviors start to come into play is when there's an issue. So if they're having thoughts, that's okay. They're talking about it. And now you can refer them to the people who can help them. Does that make sense?
General.
Yeah,
Most people say that.
absolutely.
Just speak to them.
Yeah.
But I mean, these guys are all professionals.
Yeah, absolutely. Yeah.
Instructor, individual, whatnot.
You don't have to ask that question. Yeah.
I wouldn't know that.
No, absolutely. And this is what I'm saying. That's not your role as if you're not a nursing faculty and you don't have mental health first aid, you don't have to ask that question. If they come to you and they're saying, oh, things are so stressful, I can't handle this right now, there are options. You know, you can drop a course, like there's the registrar's office, there's a learning center, there's counseling, you know, a lot of times just saying, you're not alone. Like, you're not alone here. We have lots of resources on campus that can help you, and we're all here to help you succeed. So, you know, you're not alone. Just having someone, just to hear that, oftentimes is enough. And then you can refer them to someone who will say, are you having suicidal thoughts, like me?
Or anybody in the CMT, because
Yep.
that would be something that
Yeah.
would end up being a question we'd probably end up asking before we indicated that the CMT might be an option for them.
Does Crystal have any follow-up to that? Does that make?
Quick follow-up, and she just said maybe you could ask questions like, are you having thoughts of self-harm or ending it all? So make it a little less.
Yeah, yeah.
Thank you.
There's one last scenario, and we're getting short on time. We'll put it up there, and just because it's a good one, and we'll see if we can get through it quickly so we can open it up.
Q&A, yeah.
Yep.
Do you want me to read this one?
A
Or-
student.
go ahead.
I was just delayed.
Oh, no, it's okay.
A student in your class tells you that one of their classmates has been saying things that are worrisome, such as, I can't take this anymore, I wish I was dead, and that the student has been drinking much more than usual. They are looking to you for advice. How would you handle this situation?
Or any thoughts about how you would handle, or I mean, you don't have to say if you've experienced it. I know that these are all experiences that happen on campus all the time. So that it's quite common. And it's, especially if you're the kind of professor who, or faculty or staff member who's really friendly with students, you know, if you have that good rapport with them, sometimes they'll come to you and just say, you know, they'll kind of tell you lots of stuff that is sort of outside just the learning education environment. So sometimes this happens with profs who are really friendly, have great rapport. They'll say, I heard this person say this, and we're really worried. And then that faculty or staff member feels like they're in this position now where whatever they do is going to affect the outcome of this student. Like, they are responsible now for this student's life, which isn't exactly accurate, because that student didn't ask the professor for help. You know, again, it could be an offhanded comment. Like, how many of us have said, oh, on a Friday, like, just let me sleep and never wake up, or, oh, I wish I was dead, or, oh, you know, like, and also, and I'm not trying to make light of this, but sometimes words are just words, and you're getting it secondhand from other students. So what could be in this professor or instructor's power to do to not point out the student, but maybe provide resources? Yes.
Say to them, if you feel comfortable, you can certainly mention to the student that they're more than welcome to make an appointment to come speak to me. However, these are some resources that you could pass along to your classmate. I wouldn't take this one on because that's secondhand information.
Yeah, exactly. Secondhand information is tricky, and that's excellent. And another thing you could do, because sometimes the friends would go, well, we can't tell them that we talked to you, so we can't give them the resources. So then what you could do is go, blanket email to the whole class. You know what, folks? This has been a really stressful semester. So I just want to make sure you're all taking care of yourself, and I wanted to send out these resources that are available on campus to you. You know, so then at least you're getting everybody the resources, you're acknowledging that it's a stressful time, but that, you know, you're reiterating this is just school. I know when I say that, sometimes instructors are like, what? But really, it's not worth your health, you know, so this is school, this is going to pass, and we are all here for you, and this is a stressful time, and here are all the resources that are available to you. Chances are, usually when I get situations like this, because sometimes the instructor will call me, or they'll call Connie, and Connie calls me, and then it ends up that the student was fine. They were just, you know, they were over, you know. And also, even if they weren't fine, if they did go home and do something, that's not the instructor's responsibility. And if I were to change it so that it wasn't mental health, but it was physical health, if the students came to you and said, oh, our friend was saying they were having like a lot of chest pain, and they were saying, oh, I'm not feeling good, and then they went home, what do we do? If the student was fine and just had indigestion, great. If the student died of a heart attack, would that be the history professor's fault? I don't think so. I don't think that would be the history professor. I'm saying history because I'm just throwing it out there. I don't think it would be the history professor's fault that they got secondary information about a friend who's having chest pain. You know, they can say, maybe, you know, if it seems serious, they could call it down, but that's not their wheelhouse, right? Their wheelhouse is history as an educator. So likewise for a mental health thing, such as, you know, they're drinking lots and they're saying things, that's a mental health issue. So providing a blanket, you know, resources to the whole class, or does that make sense? Does anyone have any questions or comments on that? Yeah.
One thing that I do now that we're like completely online for the most part, at the beginning of each semester,
Yeah.
I post stuff on the Brightspace course shell with all available student services, including like ACEs, Veronica. So it's all in one document. So students, I review that during the introduction class, so they know that right from the beginning.
That's
these are all
great.
available.
Yeah, so even like having it on a syllabus or on Brightspace, just having the resources right there, because life is stressful. And they are going to run into time management issues and mental health issues, and a family member might die. You know, there's lots of stuff that can happen. I know, I'm running long. So
Okay.
should we go into the Q&A?
Now for a second. So what we've tried to do today is we've tried to introduce you to us and what we're able to do to assist students at Grenfell campus. We've tried to introduce you to some of the resources that are readily available here on campus for students who might be experiencing some type of a mental health challenge in your classes and in your labs and in your offices. We've tried to identify some of the online resources that are available, the resources that are available in the community, as well as some of the resources that are available that students can readily access, like telephone resources. Most of that's all located in that information package that I think everybody got a copy of it. If online, some of you would like a copy of that information package, drop one of us an email and we will ensure that the information package gets to you with all of this information. But at this point now, what we'd like to do, we know it's 4 o'clock, but we'd like to take a couple of minutes if there are any questions that you have related to anything that we've said, or if you've got some last minute comments that, you know, might be related to the scenarios right at the end. So we'd like to open it up, and maybe Melanie, if there's anything online, you could throw it out for us. Okay, go.
At all. But I found it useful because a lot of this stuff is applicable with employee coworker relationships
Sure.
too. Because often you see stressed coworkers or coworkers that you feel are, you know, in over their head or whatever, are overwhelmed. So it is also useful to just, or even family relationships or friend relationships or coworker relationships. So.
Yeah, absolutely. And even, you know, I know in Marcom, you have students who work there sometimes. And so it's good to know, you know, the information for these students as well, because they're working on top of being a student. So sometimes you might see that, oh, you know, my professor gave me all this, and, you know, you might hear it more than like an instructor would.
I'll stereotype that the staff that we get are like the overachiever,
Absolutely.
straight A, want to tackle the world kind of students. And those students sometimes put a lot of pressure on themselves. So.
Perfectionism is a huge issue. It's a challenge. And that's why sometimes I say it's just school, right? It's not worth our health. And in some instances, I will use the phrase, D's get degrees. I'm sorry to all the professors, but that happens. And that's okay.
So if we can just, while we're waiting to see if there are any more comments, like I said, I'm with the Learning Center. If you don't know where the Learning Center is, we're in AS 234. I think it's 234. Yeah, 234. I forget the number. Sorry about that. So if you have any, you know, if students are coming in and they have any concerns or questions and you're feeling a little bit uncomfortable, if it's related to academics, you can definitely refer them to the Learning Center. But if you're feeling uncomfortable and concerned, you can also refer them to me, because I'll have a conversation with them and I might be able to determine, you know, what might be the best route. But remember, this packet of information that you have does provide you with a lot of resources that you can, you know, pass to the student, or at least make sure the student is aware of it. Jennifer can tell you where she's located and the others too.
So I'm located in Health Services here in the Arts and Sciences building on Monday, Tuesdays, and Fridays. That's where I am. Well, currently I'm working from home, but as of next week. And then on Wednesdays and Thursdays, I'm on the 3rd floor of Monahan Hall. I think nursing faculty know where I'm located, down the corner there. And while we're not an emergency resource, like I wouldn't encourage you to say, I have a student here, I'm going to send them down to you right now, because I may be in with a student, or I may be in a meeting, and then it just breaches confidentiality. However, if you would like to meet with me, or if you would like me to come into your class and do mental health talk, or if you just have an issue that you're like, I just can't wrap my head around this, if you don't have the student's consent, you can just give me a general, you don't have to use names. And I've met with instructors or staff members to just talk randomly about mental health and what like your role is as an employee and that kind of thing. So feel free to reach out to me, and I can meet with you one-on-one to chat as well.
And I'm located right next door to Campus Enforcement and Patrol. I don't have an office number on my door, but it is AS202. Campus Enforcement, everybody I think knows where they're located. It's AS201. We have a wicket that's open 24/7 in the main entrance right off of the atrium area. And our number is 637-6210. A lot of people don't look at us like the go-to for mental health related calls, because you see a uniformed officer going to a call. But I have to be honest, our officers have supported numerous students here, have helped, whether it be through, like I said, a crisis situation, or sitting and talking with and listening to a student who is upset in the middle of the night. These officers are go-to, and we are interconnected within departments within campus as well. We're interconnected within the community if that support is required.
So my office is Res 221. That's right, Jessica? Okay, I'm across the hall from the main student housing office. As a shameless plug, I'm giving a talk tonight at 7 p.m. With recruitment for any student who's interested in living with student housing next year, especially geared towards first-year students. So that's tonight at 7 on WebEx. If you'd like me to send you the link, just send me the email and I'll send you the link so that you can let your students know, or prospective students know.
Melanie, anything else online for us?
Nope, just lots of positive feedback. Tina, Purser's office, being frontline all day with students, it was great to have a presentation like this. I see students all day long and hear and see a lot of different scenarios from one extreme to the other. I forwarded some students to case management in the past, and it's great to see the help they receive. Thank you to all of those who make this available to students. And like I said, just lots of positive thank you, appreciated the information, appreciated the presentation. So.
All right.
Well, thank you.
Again, thanks a lot for coming out today and for joining us online. We welcome the opportunity to be able to reach out and give you guys this type of information and make sure that you understand what it is that we can help and provide you with too. At any point, our doors are open, and we're certainly open to having a conversation. We can talk about a situation. We wouldn't talk about the student in particular unless you have permission to do that, but certainly feel free to use us as your resource people.
And this is recorded, so we can, if you have colleagues who would like to see this presentation, we can get the link sent to you as well. Yeah, I guess that's it. Thank you very much.
Thank you very much.